All right, so welcome today to class, and today we're talking about interpreting your results and conclusion, and writing a conclusion, and also how to grade your study. So that's what we are talking about today. And without much ado, we're going to move straight. So again, this is how the lectures always goes. And where we are today, it's basically we are still around synthesis. And now we are talking about how do you interpret your findings? How do you write a discussion and conclusion? This is what it's all about. And then next week, we are going to conclude the program. So that's it. So you see, we've moved from question, protocol, da 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 da, and now we are here. And next week, we're going to conclude. Um, The importance about these sessions is that generally when you say your results, it's not an interpretation of the results. So that's the first thing that's important. So that's why we need to talk about an interpretation of your of your results. So that's why we are here. Now, what you need to also know is that when you say something is statistically significant, it does not automatically mean that it is clinically important. So there are some statistical findings that are not clinically relevant. And weak evidence should not produce strong claims. So when you see that there's very weak evidence, you should be cautious on how you talk about the value of the research you have done. Um, Grade is a framework to assess how confident you should be talking about your evidence, and that's what we are going to talk about. And finally, your conclusion should always make sure that it is very honest, it is very useful, and it can contribute to policy. That's why we are doing this session. Now, at the end of this session, you should be able to distinguish between your results from your interpretation. Your result is what we did last week. So just scrolling down the tables and putting the things together in various tables and things like that. And then you should be able to understand what grade is all about. And then you should be able to talk about how certain your quality of evidence is based on the grade framework. Um, no, I can't. Yeah, so that's it. Um, yeah. So, like I said, the session is going to, we've discussed this already. So, it's going to just be the lecture. And then I'm going to just, we're going to look at the examples that we had last week, but we're going to just look at how their discussions are arranged. We're not reading them, but it's just to give you a way of how you lead from question and how you argue your way through. And then I'll stop and you guys will present your assignments and we'll call it a day. So that's it. Results versus interpretation or versus conclusion. Again, the results is simply what we found, right? So you just discuss. We found this number of papers. They spoke about number of people who are married in Cameroon versus number of people who are married and divorced at the same time and fighting, something like that. But now in your interpretation, the question you ask yourself is what does this really mean, right? What does this really mean? Does it mean that many people are dying because they are fighting in their marriages or not? You know, since we have more people who are married and fighting than more people that are divorced, something like that. So that's when the interpretation is. And what you want to do is to assess whether it is important, it is consistent, it is precise, and it is relevant. So these are things that when you're discussing your finding, but how important is this finding? Does this align with what other people have done? How can I really puts it to the closest point number, not necessarily number, but to the closest point of evidence that this is what it means. And how relevant is it to our realities or to policy or to day life? And that's what you interpret. And you have now your conclusion, right? Which is you simply just summarize what you said to find and what you found, and that's it. And then you must then match it with the strength of evidence that you have. Because if you say that people who are fighting in their marriages are more chances of dying, then you should be able to state that you did that from because you found very good studies that assess that and found it. So that's where we're talking about. You need to match your conclusion with the level of of certainty of evidence. So just a short example here. So your results, for instance, would be that the risks, this is relative risks, right? RR. So the relative risks of people dying from argumentative wedding compared to people who are alive is 1.186. So this is slightly high. So 18% of the time. So that means that from this confidence interval is significant. So we mean that people who are fighting is true that fighting in marriages can lead to more people dying. So this is true. So here we say it's possibly small benefit, but the magnitude is modest. So the magnitude is just this is it small, right? 0.18. So you want to be sure that it's doing that. That's it. So something like that. Normally benefit will not be the word I would have used here, but if we take a positive example, I didn't have this example in my mind. If we take a positive example, so people who take paracetamol have less pain. So this would be more a positive. So there is a 18% chance that when you take paracetamol, you have less pain compared to someone that does not take it. So this simply says there's a possible effect, but there is the magnitude is not that much. So that's what it means. And then so we conclude that the interventions may improve outcome, but the certainty is limited. We are not very confident with it. So that's why we say may improve, not it will improve outcome. So in research, you're always very, you tone down your assumptions. That's what we say. So you don't want to be very categorical about your findings. Is this point very clear? Again, this is a template that you guys will have in your hand now, but when you're interpreting results, you need to always interpret the pool of the results you have and not the studies independently. So you look at all the results that you got and then you try to interpret them and then you ask yourself, what is the direction of the effect? If you're looking at a series of drugs or a series of intervention, is it reducing the effect or is it increasing the effect? How big is the effect? That's magnitude. How precise is the estimate? So you look at the confidence interval, right? And are the findings consistent across studies? Now, is this really clinically important? And is the evidence directly relevant to the question you ask and to the setting? So for most of us, our studies are African based. So is the answer true and is it relevant to the African setting? So this is how you interpret your results. And if you can start answering those questions and moving stepwise, as you answer them, that's how you build on what you write in your discussion. So that is very straightforward. My PowerPoint is not working. Move now. Good. Now, common mistakes that people would do, right, is that they equate statistical significance to clinical significance and they ignore a wide confidence interval. Last week we spoke about confidence intervals in forest plots, and we saw that in one of the studies, they had a very wide confidence interval in some places, and then they ignore heterogeneity. We also mentioned this last week, and then also ignore the risks of bias. So it's very important not to overgeneralize your results because in most of the studies, the population and intervention are made in experimental conditions, not in real world. So be very careful um, uh, that you don't overgeneralize your results. And then when your grade is very low, you don't need to say that this proves that. You can simply say that it is highly likely or we may. So you are very cautious, right? That's it. So that's why I say instead of saying taking paracetamol is effective, you would say taking paracetamol may improve the outcome of having headaches, but the certainty is low. We are not very confident about it based on the way the pool of studies we had was. So every scientist is proud of their work, but the teaching I'm trying to pass across is what my various masters and the learnings I've had from Cameroon, the UK, the US, and now Switzerland. It's been really tone it down, tone it down, irrespective of what you do, tone it down. I hope that's very clear. All right. So what is grade? I think all of you guys have been hearing me talk about grade a lot, but it simply refers to grading of recommendation, assessments, development, and evaluation. So we generally use these in systematic reviews to ascertain the level of certainty or confidence in the body of evidence. So in the example we've done so far, we've used just four studies, right? And we are going to look at it. So when you look at it in the sense, you try to use that to assess how these studies are, how certain is the result from this study based on the way they were conducted. And it rates certainty based for each important outcome. So again, if your study had several outcomes, then you're going to rate it based on each of the outcomes. But if you rate it on one outcome, then again, that's the main outcome. And it helps you to present evidence clearly with evidence profiles or summary or finding tables, which is what all the studies we do, because when you do that, you are able to actually put the summary of your findings so that everybody can see. The most important idea is that what this grade asks you to do is to say, how confident are we that the estimate, if the estimated effect is close to the truth, right? So how confident are we that this estimate is close to the truth? So that's what this is. Does any of us have a question about grade?
No, doctor.
Like, Sorry, concerning uh, this grading, I want to know, like, uh, what is actually essence of applying this grading when you're writing a systematic review? That is, if your systematic review doesn't have any grading, doesn't make it incomplete, or I don't know. Now, this grading, how is it done? Is it using a scale? From the papers you sent before that we were to read, uh, I've seen that there are different levels. That is, you have high, moderate, low. So, this grading is actually based on what exactly? That's my question, because I want to understand really what is essence.
Thank you very much for your question. So the essence of grade again is for you to say how confident are you with your results. That's just the essence. And how do you do that? You still have domains that you use to assess um, the level at which you are confident with the studies. So I'm going to ask you, Patrick, no, Frank, can you read the bullets on the slides?
The five, good evening, Doctor. Good evening, everyone. The five main grade downgrading domains.
Mhm.
We may downgrade certainty because of risk of bias, inconsistency, indirectness, imprecision, publication bias. Simple memory aid. Can I trust the studies? Do the studies agree? Do the studies match my question? Is the estimate precise enough? Could the published evidence be selectively incomplete?
All right. Now, is there any of these questions here that we don't understand? Patrick, I'm going to call you because we need to be clear on how grade is done, on why grade is done, or how it's valued. Do you understand how we should, what we mean? So again, what I would say is that when you put all the studies, let's say you have 10 studies, you're going to look at all of them and then say, well, the level of risks of bias for the studies were very high. This study was inconsistent, or this one was indirect. And then, so when you put all of that, if you have so many that are, let's say, low bias, it means the studies have good representation, right? So there you're certain that the certainty, the quality of the bias is low. So it means the quality of the study by respect of bias is high. On the other way around, if they are consistent, but if the studies are inconsistent, then you say, oh wow, study 1, 2, 3, 4, 5 said this, study 4, 5, 6 said this. But if you look at the differences, they are not very different. Then you say, oh, there was some inconsistency, and it's for you to, based on the scale that you'll find on the tool, is it low, is it high, is it moderate? And that's it. So you go through step by step and ask yourself those questions. Now, this last question is very important in the sense that this is where we assess for publication bias. Publication bias simply says that people publish only studies that have positive findings. So yes, paracetamol can reduce headache, so we'll publish it. But for the other trials that show that paracetamol could not reduce headache, they were not published, you know. So that's that's it. Yeah. And so what this looks like in real practice is that if risks of bias is high, you have poor randomization, you have no blinding, and then there are a lot of missing data on that study. If the studies are inconsistent, what you see is that the studies are going in every direction, right? Patrick, you are muted.
I know it was since you called for me, so I'm
Since
getting I'm
yesterday.
getting.
All right, no worries. So again, if the studies are inconsistent, it means one study is saying that paracetamol work, another study is saying paracetamol, another study said there was no different, and things like that. So they're just going in various directions. So it shows that there's a lot of heterogeneity that is not explained among the studies. Now, indirectedness, it simply means that they have different populations, different intervention, and different outcomes, and than what your review question had. But again, if you get to this point, it means that we already failed a lot when we were building your study, because you should not include studies that are, if you're going to do a strict systematic review, you should not include studies that are this different, right? And then imprecision is really to let you know that the sample size is very small, so the confidence interval will be very large, very wide, and so you cannot really say that the study was that significant. And so positive studies are the ones that are published, and the negative ones are not published. So that's what we mean by publication bias. There's an entire methodology to assessing publication bias, but most of the times we will not force you to assess that in systematic reviews. So can your evidence be upgraded? That's the question. Yes, mainly for observational evidence. When there is a large effect, when there's a dose response gradient, and all plausible confounders have been observed, not to explain it that way. So if you find that you have a large effect, right? And all you can simply say is that this effect is due to the fact that there is an increase in the participation of people. If we're using a digital health device, if we're talking about paracetamol, the response increase with doses and things like that. And then confounding is a very important thing. So for paracetamol to work, you need to take painkillers, right? But if somebody was already taking alcohol, it will not work very much. So we want to be sure that everybody that was in the study, probably they took out alcoholic people from there. So that's why we say adjusting for confounders. So if you can ascertain that all of these effects have been cared for, then you can say, well, based on what we have done, based on what we have found, we can see that the evidence is certain, with the fact that we have seen that there's a large effect and there's this increase, and the confounders have been accounted for. But again, you are not going to say that you are very 100% sure that the effect is what it is. Again, all what we are saying is that be very calm, be very humble when you're presenting your findings. So these are the four levels. I'm not going to go the details, but that's self-explanatory. And once you've done that, um, once you've done that, the outcome of you doing great is you have this summary of evidence table, which looks at all the studies that you've done already that are included. So outcome, number of studies, total number, sample size, your rating of it, and then the comments for any downgrade. So that's it. Again, now in systematic reviews, this is something that most people overlook, but um, some journals will not critique you if you don't do um, a strict grading of your evidence. You can just make one sentence and it's still fine. So it's not always a must that you do this, but in your summary of evidence table, you need to always present the core things that the studies represent and then what it stands for. Um, this is an example that I want us to just talk. So first you have the outcome that we are interested for is viral suppression at 6 months. So this is a hypothetical study. So we are assessing people who have HIV and they are on antiretroviral therapy. And after 6 months, we want to see if their viral load has disappeared. Good. So in that systematic review, we had five randomized control trials. That's what ROCT stands for. And then in combining all of the five trials, we had a sample size of 800 people. Now the pool effect, so the pool effect is the effect of viral suppression in all of these studies, not just one of them, is 1.18%. And this is a confidence interval. So what we are going to look at this in the end of our study is say, okay, what is the risk of bias? Maybe we can say some concerns because we have a very small effect because we have just very few studies, which is just five. And I mean, there are some details that is missing. I mean, I read this paper, so I did not want to bring the paper in class, but that's it. Now, inconsistency, if you say there's moderate inconsistency, you might consider to downgrade by one. Okay. Now, indirect thickness, there's no indirect serious concern here. So this simply means that, I mean, it's all clear that we are doing viral suppression. All of the studies were doing viral suppression. So yeah, there's no serious concern about them working with another study population and then doing viral suppression by proxy, something like that. Now, imprecision, confidence interval is relatively narrow, so we don't downgrade it. So you see that the confidence interval is 0.02 to 37. So it's narrow, so it means it's precise. If it was wide, then we would have said, yeah, we should consider downgrading it. Now, publication bias, we can't ascertain that because I mean it's just a few study. So if I count one downgrade, two downgrade, no serious downgrade, no serious downgrade, so and publication bias is unclear, I cannot say certainly that the study is of very high quality or the systematic is on high quality, so I grade it as a low. So this is again your gut feeling, how you assess it. So then we write it, there is low certainty of evidence that the intervention may improve viral suppression at 6 months. And so that's all that you need to write in your in your paper. But this is what you do behind the hood. But all of this knowledge comes when you have read all of the papers that have been involved and you are able to really say if the risk of bias had some concerns or not, or if there was a lot of heterogeneity, or if there was indirect thickness, or if the confidence intervals were so wide. So this is the thought process. And that said, once you've done that, the next thing is to write your discussion, which is really the key. This is just the anatomy. And I've generated a very big handout for you guys to use to write the discussion. And I think that's it. That's the end of my lecture. And I'm just going to show you guys. We're going to open those papers again. This is the assignment, and you guys decided to decide what You said you sent me this in the WhatsApp group that you guys are going to present. Where is it? You guys are going to present this one today. All right. But before we go to your presentation, I mean, what I'm just going to show you guys is how to write your discussion, which is very, I already shared it earlier, but I didn't, you guys didn't have the information that you needed. But this is a handout I'm going to share with you guys. And it's also based on what the Prisma asks us to write in the discussion problem. So this is it. And you have the various rules. And I mean, it's really down to earth how you should plan your discussion by paragraphs. Again, it's just for you to apply this. If you apply this, if you just apply it, you will be very fine. And this is actually your template that you can use to write and check that you're doing well. And yeah, same thing when you're talking about sentencing. And then if you did a meta-analysis versus this, these are some things that you need to pay attention to. And then, yeah, and then we also have now a summary of the papers that we showed, and you would see exactly how their discussions vary and every other thing vary. So I might want to come here. Are there any questions?
Yes, doctor, please, I do have a question.
Go for it, sir.
Doctor, I wanted to know concerning the outcome aspect that you did talk about. My problem was at the level of the confidence interval. Who calculates the confidence interval?
No, that's calculated in the software.
Ah, okay.
Mhm. So these are the papers we looked at, right? Or these are the PDFs. I don't always like the PDFs because it's not interactive. But I mean, we saw these papers last week, and um, this is one of the tables. This is what we're talking about: the evidence, the confidence, the certainty table, or the summary of evidence table. So you see that these guys have the location where they sort of come to the estimate, and then the variability and a short description of the study. This is just one example. Let me see if I can find these papers again on the internet. Um, I mean, this is my paper, and what is most important about this one is that it's more of a descriptive analysis, right? It's more of how studies have varied over time and what has been conducted. Where are the tables, Seth? Um, hmm, why is this website like that? Um, Oh, this is one. These are supplementary materials, but I'm finding table one. So, good. So you see again here that this is again what we have summary of evidence. So here you see again that the studies are given their everything, and then you have key outcome measures, and then you have principal findings. And this is a short description that I developed myself. So you have to edit them. So this is how, in the end, people would view your studies. And table two, synthesis of evidence. You see it again here, which is the same thing. We group them by the virtue of the outcomes that I was interested in. And then you see how it goes, how the differences are. So again, this is all very useful. And then you have figures now that you would design, things like that, and the rest. So that's it. But I'm going to stop here. What's most important for you guys to take home is that you have a handout to guide you to write this when you get there. Sorry if it's a little bit abstract, but that's it. The best way to learn how to write is to do this is by writing. But again, the best way to get you started is to give you guys a guide, which is what I have done. So I'm going to stop here. And yes, over to those who want to present their assignment. I received from Frank and Lydia. So I guess you guys are ready to present. Hmm?
Sorry for the background noise, doctor. There's no light and there's a generator steaming outside.
No worries, that's fine. There are worse things than
Okay,
generator.
okay. So I'm going to present my own part of the study. So the work I did.
Mm-hmm.
I'll start with the, let me see. I'll start with the grouping of studies since the assignment was for us to redo the risk of bias, to go through the 7 articles and do the risk of bias, group the studies by population, outcome, comparator, model, and to assess whether you can do a meta-analysis for those studies.
Mm-hmm.
So I would like to start by presenting the grouping of the data.
Mm-hmm. This is what you sent to me now.
Yes, doctor.
Mm-hmm.
Okay. So I used my extraction sheet to get this information, the author name. Since you said or you could use population or outcome, so I just chose this one. I did not have comparators for these studies. So I used the population, the outcome, and the model type.
Mm-hmm.
And there are some two extra columns there
Mm-hmm.
for area under the curve and accuracy. I added accuracy because for one of the studies they assess the model, the AI model there, but they did not check for they check only for the accuracy and
Mm-hmm.
F1 score or something like that.
Yeah,
So
F1
I
score.
had to, yes.
Mm-hmm.
All right. So since there were 7 studies in total, but the studies that actually assess cardiovascular disease risk were these ones that I included that I could identify. So
Nice.
the populations for the first study was diabetic patients. The other ones had patients did not differentiate whether they were cardiovascular or not. They just grouped all the patients together and later on separated later. It was not a
Mm-hmm.
specific patient group. And then
Yeah,
another had patients who had stroke, and the other ones had patients with cardiovascular risk factors. And
good.
then for the outcome, yes, the outcomes are the same diseases. So I listed all the models that were included in the various studies and
Mm-hmm.
their area knowledge and accuracy. So this was how I grouped the information I got from those
Very,
articles.
very good job. I am very impressed. Very good. Very
Mm.
well done. I mean, you see that just some supportive comment. You see that it's not difficult. It's just for you to organize the information from the paper. And if I mean right now, if you're doing an overall system, a meta-analysis for this kind of work, what do you think you'll be looking at?
I mean,
And
if I'm doing a meta-analysis for this study, doctor,
mm-hmm.
uh, I would want to know if they were all assessing the same kind of AI model, I would have been checking if this model actually is accurate, it has been proven to be effective or something like that.
Mm-hmm.
Yes,
But
but
yeah.
since okay, then the other document I sent had my assessment if we could do a meta-analysis on it. So
Right.
according to this table, the the outcomes were they were a little bit, they are all cardiovascular diseases, but they were all different somehow because a stroke patient is different from a patient with coronary artery disease,
Mm-hmm.
but they all fall under the same umbrella. And the populations were different. Some were having diabetic patients, other had stroke patients, the other one had the general population. And then they did not have the same AI models being assessed in the various studies.
Mhm.
So on those basis, I could say that a meta-analysis will not be very suitable for the study.
All right. Nice. Thank you very much. That's very good. Very good. Very well done. Great. Is there any other thing you sent? These are the two documents you sent now.
Yes, doctor. For the risk of bias, we already did that one before, so
Yeah,
I just
that's fine.
resent
Yeah.
it time around,
Mhm.
and I
Mhm.
reduced the other articles which I did not include my study.
Mhm.
And I think it was just one study that I think that the population was not the study sample was not representative of the population because they had just 173 participants. So I was
Mhm.
not sure that it was representative of it.
No, I
And
mean,
that's
representation does not only mean by number, right?
yes, yes.
Yeah. Representation doesn't always mean by number. Representation guy actually did they include the people in the age group and in the locality that they were aimed to mention? The
Okay.
number, the sample size is always a limit because there are many things that come into your research. Is it feasible to get many more people or not, and things like that. So, but
Okay.
very well done. Yeah, yeah. This is all that table, and you did it very well. Nice. So all of them were quantitative studies, and you scored them 5, 5, and 4. All right, that's nice. Good. Clap for yourself.
Thank you, doctor.
Mhm. All right, the next document I have was sent to me by Frank. Frank, are you ready to present?
No, no, please, I would like you to share the document. I'm using my phone. I'm not using my laptop now.
It's okay. I know your laptop, you have given it for how do they call it?
Oh, if I connect my laptop, you'll be slow.
Yeah, giving your laptop for a wolf. That's how we used to say it. Right. This is a document you sent now.
I sent, I sent two documents.
Eh?
I'm not able to see what it's not showing on your screen.
Yeah, no, no, I'm going to share. Are you sure? Why is it not sharing?
The name is meta analysis, the name of the document.
It's okay. Let me share my screen so don't cry. So, Frank,
Okay.
in your village,
Yes.
I will not rest until I'll ask you this question. Let me
No,
go.
this is not the document. I sent another one.
Wow. Yes, let's go to the email because
The most
I need to attack you in the email. The most recent one, you sent me 6 emails at the same time with nothing.
my network was disturbing. I thought it was not going.
So should I blame you or the network? So
No, it
Frank,
should be.
Frank, in your village, they write emails on the title. So which document am I taking? Is this how I send emails to you, Frank? Huh?
No, sir.
So why do you send emails like that to me?
Sorry, sir.
No, you don't have to be sorry. Why do you send emails like that to me?
That's a mistake.
But you sent it twice, so I don't understand. Try even. So
I
how
had
can
issues. I
how
had
can you
issues.
blame?
I really had issues sending this email. I really had issues. I definitely used my somebody else's phone to send it because my own email in my phone I had to connect to somebody's phone before I started sending it.
Which document are we looking at? This one
The
or this?
most the one of
So this one.
I guess. Okay.
Don't rush us, say it's okay. Yeah, come in. Okay, you have the floor, Professor.
Okay, good evening everybody. So The assignment that we had was to determine if a meta-analysis could be feasible with all the different studies that we had. So what I first of all did, I first of all copied all the studies down and I divided the population, the model type, the comparator and outcome. Since to do a meta-analysis, we need to identify if they have similar outcomes, similar AI models and similar populations. So from what I've seen, majority of the since all of them are assessing cardiovascular risk factor, but the outcomes are not typically the same because some will be assessing maybe stroke, the other one will be assessing prediction of cardiovascular risk factor disease and identification in the population. And also, I've noticed that they have different AI models, especially some will be using the Framingham risk score, the other one will use the traditional statistical, the multiple machine learning algorithm, the other one will use automated machine language framework. And so I've seen that majority of them are having different different model type. The population too. Some with the UK Baobab was used in some of the articles, while the other one population from Ghana, they have different population. But here I was more focused on the outcome and the model that they were used. And from what I've analyzed, I've noticed that at the end of the presentation, I realized that the meta-analysis could not be feasible in this study because they have different outcomes and different models are used for each of the studies.
Very well done. I just have one question. How do I know which study is which one?
Doctor, I wrote the studies, I wrote the title of the studies under before I wrote the population outcome.
Where is the title of the study?
The study be on the column of studies down in the title.
This one. This is the title.
Yes, doctor.
Jesus Christ. Where is the author?
Doctor, I knew that we have been using the studies now, so I knew we would connect the studies.
Hmm.
Sorry, next time I will make the presentation look more presentable.
Hmm. Okay. Anyways, good job. Good job. Any other person has something to present? I mean, just two people sent the assignment, so another person has anything to present. Afai, who are you working with? Oh, you're working with Lydia, and you had exams, so it's okay. Lydia has really bailed you out. Don't cry. All right, guys. So, um, does any of you understand why I asked you guys to go through to do that assignment? Frank or Patrick, who wants to talk?
Doc, I think you asked us to do the assignment to actually figure out um, whether from the four studies we decided to include, is it feasible to do a meta-analysis or a narrative synthesis from them?
Mm,
So we actually to figure out the outcomes, are the outcomes similar, the interventions, comparator, even the various studies. Are the study designs, are they similar or are they too heterogeneous? Is there
mm,
insufficient data to include it and to be able to do a meta-analysis? I think that was, first of all, the main goal why you asked us to do the assignment. And I
mm.
think the second part of the assignment was also to assess the risk of bias for the assignment. Well, I think we did not actually
Do that
provided
yet.
that.
Mhm.
But if you check your emails, but I think I have sent it. Maybe not this week. The last week I've sent it with the document. Among the documents I sent, I think I've sent it also. Um, I think
Professor,
we did that already.
you guys did the weeks
Well,
of bias already, so you guys don't need next week to do it. Anyways,
Wow,
I did not see the email, so maybe you want to check the email you sent to me. Patrick, the only thing I see is requesting access.
wow, Doc, wow.
That's the only thing I see now. Let me share my
I mean,
spreadsheet.
I mean, wow.
I see your Medline screening template. That's it. I mean, this is enough. I'll share my screen again.
Peut-être je n'ai pas envoyé.
Oui, peut-être tu n'as pas envoyé. Tu étais dans d'autres choses. This is it.
Oui,
This is
oh,
it now. This is you requesting access. That's why I know
oh.
about you. Requesting access.
I mean, before that, like,
Well, this one, Medline says strategy. And I already replied to this one.
no, 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 that one.
This is
I mean,
February
the
26th.
assignment.
That's what I'm looking at. Is it not my email box? Are we not looking at the same email together?
Is it now?
It got stuck with MTN. It's okay. Send it again. Whatever you have, send it again. It's fine. Afayi, how are you? How are your exams?
Doctor, I had a very difficult week.
Hmm. Tell me more.
Doctor, and then the exams like that, doctor.
Is that why your volume is? It's as if you are doing
Doc,
the
I don't even
exam.
know.
It's okay.
Doctor, I don't even know how to describe it. It was well, the important thing was to pass.
Good. Have
But
you passed
it was
or
not
you're
really
still
the
waiting for result?
best.
I mean, just pass. Just pass.
No, I believe, I believe I'll pass, but the process was not really the best.
All right. That's
I
okay.
mean, but it's also a problem of language because it's equally a problem of language because some of those doctors wanted me to give them exactly what they know. So
Mm-hmm.
I gave what I understood from what the topic is, but they wanted what they know word for word. So
Mm-hmm.
it was not really. But anyways, the important thing is to pass.
Yeah, just pass. That's fine. Anyways, good, good, good. Courage, huh? We all went through that journey. So if we are alive, it means you'll survive. Anyways, guys. So this is what I want us to end with. So next week it's the last session, and I not expect you guys are going to present next week, but you guys are not going to present the assignment. So I need you guys to send this assignment to me by Friday, and I'm going to assess it myself, right? But all of you are going to do a one slide presentation of your topic, what you have done so far, what are the challenges, and what are the next steps. One slide presentation, and send me those PowerPoint slides on Thursday. I am going to put all of them in one slide so that on the day all of you guys will be presenting. And we are going to have your mentors join us. So next week we'll have a short lecture to talk about how to write your paper, and that's it. And again, I'm going to generate the hand. I mean, wait,
Yeah, I mean, we
Jesus Christ. And again, I'm going to generate a handout for you if you need how to write. But I've already shared the most important things in the handout that you received today about writing. So that's what we are going to do next week. And what I said before, I think it's Frank and Afai joined, was that we would start entry for the next cohort, hopefully by the end of next month. So if you look at your timetable, we are at, you guys will have exactly 1 month up to April 30th to complete your systematic review. You have up to April 30th to complete your systematic review, and after that, we would move to the next batch of people, probably starting in May. But yeah, we'll move to the next batch of people. So you guys will have this 1 month to do what you have to do till the April 30th. So this is where you are going to be talking more with your mentor and revising what you're doing. And I'll be checking in every week. If I'm too boring, don't reply me, okay? I'll not take heart. But next week we have a short thing about me just talking about writing. And then you guys will present your topics. One slide. I'm going to send the slide template for you guys to use. Your topic, one slide, and then what you have done so far and where it is next. So I'll be expecting you guys to send me your search strategies, all of you, your search strategies and the corrections from your topic summaries that you've been able to do. Because now what is left for you guys to do is to fine-tune the search strategies and then complete your protocol, and then we do an extraction for each of you. So for those who have had their topics cancelled, you have to redo it. You have to do it at a faster pace. But that's it. And at the end of the course, I'm going to ask you guys to um, review the course. So you have a form that is just reviewing the course. I know you guys don't like form because only 2 people took the quiz for a very long time, which is fine, but the form is to help us improve. And you guys are going to be inviting 2 people into the program next. But the difference is that those people are going to pay a fee of 10,000 francs. So because I realize that the interest is just because nobody is paying something, and so people don't want to invest. I mean, the 10,000 francs is really not much, but it's just so that people are engaged. But yeah, that's it. You can Google how much a course like this will cost you if you have to pay for it. But that's just to make sure that people have skin in the game. But yeah, that's it. So 2 people, if you have anybody to recommend, we'll continue. That's it. But again, what's most important is your manuscript ready for publication by the end of April. So as we round up next week, you need to focus on doing everything that in a week's time your proposal is ready, and I will review it, and then we submit it, and then you continue with extraction, and we plan your systematic review for all of you. For those who don't want to publish, it's fine and good. I hope this knowledge will be useful for you to use in your future life. But after the 30th of April, we'll continue with only those who are interested in doing research. Yeah, that's it. I'm going to end here. So, any questions? Any questions about what I have said? Any reactions? I saw somebody sending emojis, but that's it. If there are no questions, then I'm going to stop the recording and we can take our selfie.